Assalamu alaikum. I am Dr. Tabia Bakai and today we will be discussing our new lecture topic name is Otitis Media. Let us begin by reviewing the outlines for today's session. First we discuss about the introduction, then causes, types, sign and symptoms, diagnosis, prevention, complications and in the end conclusions. We will start with the introduction, providing a clear understanding of what otitis media is, followed by an in depth discussion of its etiology, classification, clinical features, diagnostic approach, preventive strategies, and potential complications. The image, as you see in the slide, is labeled otitis media. It features a cross section of the human ear, divided into three main parts. Number 1, the external ear, number 2, middle ear, and number 3 is internal ear. As you see in the picture, the middle ear is highlighted as the area affected by the otitis medius, with a label indicating inflammation and fluid accumulation in the middle ear. Number 3, the Eustachian tube is also labeled and shown as narrowed. Now let's move towards the introduction. Otitis media, commonly known as the middle ear infections, occurs when the middle ear becomes inflamed or infected. This can cause by bacteria or viruses and can lead to fluid buildup in the middle ear. Otitis media is a prevalent condition, especially in children, and can have a significant implications for hearing and overall health. Now we will move towards the second slide, that is causes. So let me start the causes. Several factors can contribute to the development of otitis media, including number 1 is bacterial or viral infections. Bacteria or viruses can cause the middle ear to become infected, leading to inflammation and fluid buildup. Number 2 is Eustachian tube dysfunction. The Eustachian tube connects the middle ear to the back of the throat and helps regulate ear pressure. When this tube is blocked or not functioning properly, fluid can accumulate in the middle ear, increasing the risk of infection. Number 3 is allergies. Allergies can cause nasal congestion and swelling, which can affect the Eustachian tube and increase the risk of otitis media. Number 4 cause is cold or sinus infections. Respiratory infections can spread to the middle ear and cause otitis media. Now let me move forward towards the third slide, that is the types of otitis media. There are several types of otitis media, including number 1 is acute otitis media. Acute otitis media is a sudden onset of infection and inflammation in the middle ear. It is often accompanied by symptoms such as ear pain, fever, and hearing loss. Number 2 type is otitis media with effusion. Otitis media with effusion is characterized by fluid buildup in the middle ear without signs of acute infection. It can cause hearing loss and increase the risk of developing acute otitis media. Number 3 type is chronic otitis media. Chronic otitis media is a persistent or recurring infection of the middle ear that can lead to the long-term damage and complications. Now let me move towards the next slide, that is the sign and symptoms of otitis media. The sign and symptoms of otitis media can vary depending on the type and severity of the infection. Common symptoms include number 1 is ear pain. Ear pain or discomfort is a common symptoms of otitis media. especially in children. Number 2 is hearing loss. Fluid buildup or damage to the middle ear can cause temporary or permanent hair loss. Number 3 is fever. Fever is often present in cases of acute otitis media. Irritability. Infants and young children may become irritable or fuzzy due to ear pain or discomfort. Number 5 sign and symptoms is discharge. In some cases, otitis media can cause discharge or pus to drain from the ear. Now let's we move forward towards the diagnosis. The diagnosis of otitis media typically involves a combination of medical history, physical examination, and diagnostic test. These may include otoscopy. An otoscope is used to examine the ear canal and eardrum for signs of infections or fluid buildup. The two diagnostic tests is tympanometry. Tympanometry is a test that measures the movement of the eardrum and middle ear function. Number 3 diagnostic test is hearing test. Hearing test may be performed to assess hearing loss and determine the extent of the problem. Now we move forward towards the treatment of otitis media. Number 1 treatment is antibiotics. These medications help fight bacterial infections that cause otitis media. They are usually prescribed for 7 to 10 days. Number 2 treatment is pain relief medications. Over-the-counter medications like acetaminophen, Tylenol or ibuprofen, Advil, Motrin can help reduce ear pain or discomforts. Number 3 is decongestants. These medications help relieve nasal congestion, which can contribute to Eustachian tube dysfunction and otitis media. Number 4 treatment is warm compresses. Applying a warm compress to the affected ear can help reduce pain and discomfort. Number 5 or last treatment is rest and hydration. Getting plenty of rest and staying hydrated can help the body fight off the infection. Now let me move towards the next slide, that is the prevention. Several strategies can help prevent otitis media, including number 1 is practicing good hygiene. Washing hands regularly and avoid close contact with people who are sick can help reduce the risk of respiratory infections that can lead to otitis media. Number 2 prevention is avoiding exposure to smoke. Exposure to smoke can increase the risk of otitis media. So, avoiding smoking and secondhand smoke is important. Number 3 is breastfeeding. Breastfeeding has been shown to reduce the risk of otitis media in infants. Number 4 prevention is staying up to date on vaccinations. Vaccinations such as the pneumococcal conjugate vaccine can help prevent infections that can lead to otitis media. Now let's move forward towards the next slide, that is the complications. If left untreated, otitis media can lead to several complications. Number 1 is hearing loss. Persistent fluid buildup or damage to the middle ear can cause temporary or permanent hair loss. Number 2 is speech delay. Recurring ear infection can affect speech development in young children. Number 3 is mastoiditis. Mastoiditis is a bacterial infection that can spread from the middle ear to the mastoid bone, leading to serious complications. Number 4 complications is chronic ear problems. Untreated otitis media can lead to chronic ear problems such as persistent hearing loss or recurring infections. Now, in the end, we will move towards the last slide, that is the conclusion slide. Otitis media is a common condition that can have significant implications for hearing and overall health. By understanding the causes, types, signs, and symptoms of otitis media, as well as strategies for prevention and treatment, individuals can take steps to reduce the risk and manage the condition effectively. If you suspect you or your child may have otitis media, it's essential to consult with a healthcare professional for proper diagnosis and treatment. Now that's we concludes today's lecture. I will return soon with a new topic. If you found my video lecture useful and informative, please don't forget to like, share and subscribe to the channel. Thank you.